Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over my grand tour of Africa, where a lot of the components um, are taped through my videos to increase awareness all around the world for these governments. So let's go ahead and get started. This picture is really interesting to me because this was the picture that took place as protests on February 20, 2011. So this is kind of the picture all across the streets of Morocco that you saw. By the way, this is from Morocco, the country Morocco. And I'm just going to share some facts that are important and interesting. So the government is a constitutional monarchy, but there's also and the leader, King Mohammed VI, he holds significant executive authority. And so the political system is a mixture of elected institutions with strong royal influence over security, foreign policy, and major development projects. Stability is comparatively high for the region, though issues around governance, press freedom, and social inequities persist. Um, Western Sahara remains a central geopolitical issue, shaping foreign relations with the U.S., European Union, and the African Union. So, what are the sectors? Economic profile. These are always interesting to tell. Um, Automotive manufacturing, the leaders in Africa. Phosphate production is a global leader. Agriculture, they grow olives, citrus, grains, and the highly climate sensitive. Tourism, everybody has heard of Marrakesh, but also Fez, Agadir, and Sahara routes. And then renewable energy. Solar complex is world class from there. What are the challenges? These are the good things that I said. Now, the challenges are there's a lot of unemployment among the youth, rural, urban inequality, water scarcity and drought, and then inflationary pressures linked to global supply chains. Um, the healthcare system is interesting, and before I do that, I wanted to say that the population of Morocco is 37 million people. And there's strong linguistic diversity like Arabic, Berber, French, all of these. Um, and there's gaps in rural education, healthcare access, and employment. So we don't see as much inequality within the cities, but once you get into the rural areas, there's scarcity of education, healthcare, and employment. I actually did a paper, conducted research with one of my previous students about 10 years ago about ultrasound cost and how monitoring the baby within the womb um, actually, if you have a public-private partnership, then they're able to do ultrasounds at a low cost. Um, so again, as I said earlier, there's a mixed public-private model, and you'll see a lot of this by public-private partnerships all across Africa. And some people have mixed feelings about the effectiveness of public-private partnerships. A lot of times, if you have capitalism entering the healthcare system, then this doesn't benefit the whole population, but a certain few that are in the middle or upper class. Um, I keep on emphasizing this because it's important. Rural access gaps, shortages of specialists. A lot of times, the family medicine physician or the community health worker looks at many diverse sorts of diseases, missing on some of the common diseases or those diseases that need to be treated in different ways. And then there's heat and water scarcity, which is always a problem in these areas. Um, Now, I wanted to kind of go into some of the aspects of the healthcare system in Morocco, the situation. So let's go into the public sector first of all. The Ministry of Health and Social Protection oversees hospitals, primary care centers, and national programs. The problem is trying to make revenue from a public system creates some inability to protect the people. So there is a necessity for private um, funding as well. But this has to be done in a balance so that the impoverished individuals can also access the increased healthcare access, so that there can be healthcare for the full population, or universal healthcare, as we say. There's insurance schemes, and these are mandatory, kind of like Obamacare that we saw. So AMO is for formal workers, and then RAMED for low income populations. And so Morocco has taken into consideration some of the lower income individuals. Um, so the private sector is rapidly expanding clinics, specialty centers, and diagnostic services. But again, the private sector has dangers in that they will only cater to the rich and not the poor. But there's schemes or ways to do that. Healthcare workforce and infrastructure, growing number of med schools and training programs, investment in hospital modernization, and expansion of specialty services. So, what are the burden of disease? Three things, which are communicable diseases. Tuberculosis is a public health priority. Hepatitis B and C present ongoing challenges, and then there's periodic outbreaks of vector-borne diseases, leishmaniasis, dengue, and whatnot. Now, non-communicable diseases, this looks almost identical to high-income countries. In fact, cardiovascular disease, diabetes, hypertension, cancer, um, these are all rising. Um, Maternal child health, declines in maternal mortality, which is always a great sign. Strong vaccination programs and expanded prenatal and postnatal care. Rural access um, is short, is small, due to the rather than urban access. Mental health is under resourced, few psychiatrists per capita, limited inpatient psychiatric beds, and stigma and low service utilization. And then there's a growing burden of depression, anxiety, and substance use. So there's a lot of components that are involved. Stigma is a huge component, with whether you go into the villages or whatnot. And there's a lot of traditional healers. This is all across Africa, which people still rely on in order to get treatment. Um, so health financing. This is always especially important when you're thinking about financial situations as it pertains to healthcare. So the public spending remains below World Health Organization recommendations. Out of pocket payments are high, especially for diagnostics and specialty care. And then reforms aim to unify insurance schemes and reduce financial barriers. And that's I've been talking about this as I describe this more and more. Um, Digital health and innovation. There's a lot of e-health strategies, national e-health strategies, telemedicine expansion into rural areas, and we see this similar kind of pattern in the United States, where telehealth with stroke and other things, and how to treat strokes and recognize strokes comes from by individuals that are living in the cities, doctors in the cities, and through telehealth they can reach rural areas as well. Um, Public health and surveillance. Morocco maintains surveillance systems for communicable diseases, environmental health, water scarcity, heat, food safety, and whatnot. And then climate and environmental health, drought, water scarcity, heat extremes, desertification. So I went over about nine components that are especially important to take into consideration. So when you're thinking of Morocco, it's not a very poor country, but there's a lot of improvements, like unemployment and whatnot um, needs to be considered. And then public-private partnerships are one of the strategies that Morocco has used to finance the healthcare system, but still out-of-pocket costs are really high, and so that leads to some barriers for individuals that may be poor, prohibiting cost being prohibitive for universal health care. So that's about it. I wanted to go over some of these pictures. I know that there's there's a lot that I've covered already, but this is the Moorish art. Um, this is another picture of how the streets were covered with people. Um, and so yeah, so that's it. So I hope all of this has made some sense. Thank you for listening.